Psychiatric disorders are the leading cause of insomnia. Why does this happen, and what can you do?
For people with mental illness, be it depression, schizophrenia, anxiety, or bipolar disorder, living a healthy, normal life is already challenging. Throw in insomnia, and it can be downright impossible. Unfortunately, as many as 80% of patients with major depression, 77% of people with bipolar disorder, and 70% of individuals with post-traumatic stress disorder also report sleep problems. In cases like this, where mental illness is already diagnosed, insomnia is usually considered a symptom of the pre-existing condition. This makes sense, as the persistent anxious, depressed, hysterical, and confused thoughts shrouding a mental illness can make it impossible to sleep. But new evidence suggests insomnia may, over time, be a cause of mental illness. In a University of Berkeley study, patients were shown a set of disturbing images after 36 hours without sleep. Afterwards, these individuals displayed 60% more activity in the brain's emotional center than did the normal, rested group. People who were sleep deprived had significantly more trouble controlling their emotional responses. Here's the good news. Treating a mental illness effectively will often take care of insomnia too. With few exceptions, this means regular episodes of talk therapy and some form of prescription medication aimed at the mental illness in question. It's important to note that some meds, like the antidepressant Wellbutrin, may have side effects that cause insomnia. Some doctors will treat insomnia and psychiatric conditions simultaneously. Insomnia medications include Ambien, Rozarum, and Lunesta. Sometimes it's more effective to teach patients good sleep hygiene, like only spending time in bed for sleeping and sex, and avoiding bright lights like the TV and computer beforehand. Despite these effective treatments, an estimated 70% of people with insomnia do not talk about sleep with their general practitioners. You don't have to be among them. If you're experiencing recurrent insomnia or abnormal mood symptoms, see a doctor.
Parasomnias are common childhood sleep disorders. There are several different types of parasomnias that are developmental in nature. The most common one that we see in young children are sleep terrors or night terrors. Sleep terrors or night terrors are abrupt, spontaneous, or triggered arousals from deep sleep in the early part of the evening or night after the child is put to sleep. The child looks panicked, scared to death, they're sweating, their pupils are dilated, they appear to be awake because their eyes are open, but they're actually still someplace in between deep sleep and trying to wake up. All parents can do is console them, protect them from harm. We recommend they do not stimulate their child because it may prolong the night terrors. The second most common problem that we see in the parasomnia category is sleepwalking, and actually more common in older kids and may last longer for their life. It is usually developmental, but if it persists beyond a certain age, we become concerned about post-traumatic stress disorder. Same is true of sleep terrors as well. Sleepwalking can be dangerous or benign. The dangerous type of sleepwalking I'm referring to is where a child may fall down the stairs during sleep because they actually are asleep and walking, not awake, not aware of what's going on, and they don't remember what, or they may run out the door, run out into the street, or even go to the refrigerator and eat in the middle of the night and not remember.
Very few people remember what happened during their sleep.
In Australia, an even more extreme case of sleep sex. A woman would leave her house, seek out men and have sex with them before returning home to her bed. And she slept through every encounter. Her doctor reported the incredible case to the International Sleep Disorder Conference in Sydney. Sleep stalkers remember nothing of their activities. It often goes undiagnosed until it's too late.
The first patient that we saw had abnormal behavior of this type for 15 years, had injured his wife on a regular basis. Nobody mentioned it till he tried to strangle his wife, trying to have sexual intercourse in the same time.
Sufferers of cataplexy have the opposite problem. Too much excitement of any kind sends them to sleep.
Cataplexy is defined by losing your muscle tone and being floppy suddenly when you're getting excited or happy, most often when you're laughing.
This is why some people literally fall down laughing. Christina suffers from narcolepsy. She can fall instantly asleep at any moment.
1 minute standing there fine, and the next I'm on the floor, I mean, it just looks like I passed out or something.
300,000 Americans also have narcolepsy.
What we know of narcolepsy is that it's primarily a disorder where sleep is completely disorganized.
Much of what happens in the sleeping brain remains a mystery. But we do know our brains experience intense bursts of activity. Marked by telltale rapid eye movement, the brain is busiest while we dream. During so-called REM sleep, the body releases a chemical that paralyzes the muscles. This keeps the body at rest during the dream phase. If that chemical fails to trigger, a range of disorders can occur, from sleepwalking to sleep stalking, even sleep murder, because there's no conscious mind to separate fantasy from reality. For people whose brains do bizarre things while they slumber, sleep itself becomes a nightmare.
The Bahamas Neurological Center, established since 1999, the only facility in the Bahamas that offers comprehensive neurological, neurodiagnostic, and neurorehabilitation services at the one local. The first comprehensive neurological clinic in the Bahamas. The only multidisciplinary facility in the Bahamas catering to the English-speaking Caribbean. Our main mission is to provide our local and worldwide customers with qualified medical providers and administrators who can deliver world-class standards of service and products within the Bahamas and Caribbean region while promoting our customers' good health and overall well-being. Rehabilitation services. We utilize an interdisciplinary approach to the management of clients with neurological disorders. Our neuro rehab team comprises of neurologists, nurses, clinical psychologists, physical therapists, and occupational therapists. We treat children and adults with disorders such as cerebral palsy, brachial plexus injuries, developmental delays, learning disorders, attention deficit disorder, autism, epilepsy, spinal cord injuries, Alzheimer's disease, orthopedic injuries, and Parkinson's disease. Physical therapy. Our physiotherapist provides comprehensive assessments and treatment of musculoskeletal injuries. A strong emphasis is placed on active rehabilitation programs which return clients quickly and safely to their pre-injury condition. Each treatment course is specifically designed to meet the individual requirements of each client. Physical therapy treatment options. Some of our options are physical assessments and treatment plans, soft tissue manipulation, joint mobilization, electrical stimulation and microinferential current, therapeutic ultrasound, ergonomic analysis, and patient and caregiver education sessions. Occupational therapy. The goal of our occupational therapist is to help our patients achieve the best optimal function in all aspects of their life, including work and self-care. With the help of our occupational therapists, our patients are able to gain personal independence to help them reintegrate into their environment, for example, work, school, etc. Evaluations. Some of our evaluations are cognitive performance, instrumental activities of daily living, customized treatment plans, cognitive remediation, development of fine motor skills, and recommendation for assistive devices and home modifications. Psychology. The overall goal of the clinical psychologist is to reduce any psychological distress and promote the emotional well-being and overall development of children, parents, adults, and families. The focus is on the patient's behavioral, emotional, and social functioning. Therapy. Some of the areas we deal with are cognitive behavior therapy, depression, anxiety, behavioral modification and management, general counseling, both grief and coping, developmental delays and special needs, and stress management.